The contents of this presentation are those of the authors and do not necessarily represent the official views of, nor an endorsement by, the Centers for Disease Control and Prevention, the U.S. Department of Health and Human Services, or the U.S. government. Hello! Welcome to Module 2 of the Childhood Lead Poisoning Prevention Training. We're focusing on strategic planning and implementation of 4 key strategies. Today's key strategy is targeted population-based intervention. There are images featuring a father with a young daughter in his lap, a picture of a mother and child at the doctor's office, and classroom with diverse students. At the bottom is the image of the Centers for Disease Control and Prevention logo, which also shows that CDC is a part of the Department of Health and Human Services. The purpose of this segment is to help you develop strategic partnerships and policies and implement targeted population-based interventions that focus on community-based approaches aimed at the primary prevention of lead exposures. At the end of this segment, you should be able to explain CDC's strategic priority to eliminate childhood lead exposure before children are affected. The second objective of this module is to develop and implement a strategic partnership primary prevention plan. And a third objective is to assist with integrating community-based organizations into your primary prevention plan. CDC thinks of population health as an interdisciplinary, customizable approach that allows health departments to connect practice to policy for change to happen locally. These are interventions that are population-based. They're based on a group of individuals living in a specific community, and we think that you'll be able to customize the approach to make sure that all the voices in your community are heard. Population-based interventions are implemented community-wide and designed to impact the community as a whole. So, in this case, if you've been doing a lot of clinical kinds of medicine, understand that when you do population-based interventions, that community is your patient, if you will, and the impacts should be seen across the community as a whole. This approach uses non-traditional partnerships among very different sectors of the community, so you need to include public health folks, industry, academia, healthcare, local government, and entities, etc., to achieve positive health outcomes. That's ensuring that all voices are heard. The good news is that lead poisoning is preventable. Primary prevention is intervening before adverse health effects occur using measures such as vaccination. You administer a vaccine to prevent acquiring an infectious disease or alter risky behaviors to prevent an accident. A regulatory intervention is the banning of substances known to be associated with a disease or health condition. Lead paint was banned in the late 1970s because lead paint was an exposure source for children. Primary prevention in terms of lead means to remove lead hazards from the environment before a child is exposed. It's the most effective way to ensure that children do not experience harmful long-term effects of lead poisoning. It's important to note here that no level of lead exposure is safe for children. The best way to completely prevent any effects on children is through primary prevention. Primary prevention is necessary because the effects of lead may be irreversible. A snapshot of a fact sheet on steps to make your home lead safe. Secondary prevention aims to identify a disease or condition in the earliest stages before the onset of signs or symptoms. Screening for lead is an example of secondary prevention to determine if a child has been exposed. Left unchecked, exposure may cause decreased IQ, anemia, and other symptoms. If a child is identified who may have been adversely affected by lead, the next step is to take the lead out of his environment. Tertiary prevention aims to soften the impact of an ongoing illness or injury that has lasting effects, which in this case would include monitoring the academic progress of children with higher blood lead levels and providing remedial education services as early as possible. So that's a way to provide support to children who may be affected by lead, but it doesn't necessarily cure the child. There are a few basic things that need to be done in order to understand and think about how you can interface with the impacted communities. The first is cultural knowledge. It's important to be familiar with the cultural characteristics, history, belief systems, and values of the community that you're interested in serving. Understand where they're coming from in terms of their culture. The second step, then, once you know about the culture, is to become culturally aware. Understand yourself and work on an ability to respect other cultures. Understand how your own culture may affect your thinking about other people's cultures. Cultural sensitivity involves understanding the differences between cultures, but not making value judgments about these differences. So understand that their religious practices may be very different from your religious practices, but don't make a value judgment about this. And when you've gone through these steps, you should improve your cultural competence. or the ability to effectively operate in different cultural contexts using appropriate behaviors, attitudes, and practices. Work toward understanding how the culture of the people that you're working with may affect their thinking or the way that they may think about lead exposure. In public health, acquiring skill in cultural competency is an aspirational goal. Cultural competence is the ability to understand perspectives and the ways of people from differing backgrounds without judgment or applying personal biases. Other terms that we use in this kind of work are health equity and equality. So these pictures here, the top one will give you an idea of what is equality and inequality. Inequality is when only some people have access to all the opportunities, and equality would be providing tools and assistance equally to both boys. Each has been provided the same type of ladder, but the boy on the right is still not getting any apples. Justice involves fixing the system to offer equal access to both tools and opportunities. So in this case, instead of giving them both the same height ladder, the tree is moved to give the boy on the right greater access to the apples. Equity is achieved when we customize the tools that identify and address inequality. So in this case, we know that we're not going to be able to bend the tree, but we're going to give the little boy on the right a taller ladder so that they have equal access to all the apples. Equity is our goal. Start with equality and be prepared to give more tools and resources to some people than to other people in order to achieve what you want, which is equitable access. 4 pictures demonstrating the differences between inequality, equality, equity, and justice, using children picking apples using ladders to reach the top of the trees. Let's think about the elements of a program for primary prevention of childhood lead poisoning in housing. A few things that you can do, that you should be doing, is to use national and local data sources to identify high-risk areas, populations, and activities associated with housing-based lead exposure. So that means when the data come into you from your local healthcare providers or other kinds of blood lead screening programs, you need to review data in your service area. Review the data to see where in the community are children more likely to have high blood lead levels. In addition, review housing-based information you may have access to, such as age of housing or the percentage of rental property to locate communities at potential risk. You need to identify local experts, relevant organizations, and strategic partners to expand resources and motivate action for primary prevention, understanding who in your community is considered an expert in healthcare generally and in behavioral health and relevant organizations. That would also include community decision makers, realtors, and it might include judges. Think broadly about the relevant organizations that you need to form these partnerships with, and then, using all that information that these experts are going to bring to you, develop strategies and ensure services that are going to create lead-safe housing. Develop and codify specifications for lead-safe housing treatments. When contractors are commissioned to do renovations to remove lead, ensure that those renovations are done in a manner that doesn't make things worse. Engage in collaborative plans and programs with housing and other appropriate agencies. So working with the Housing, Local Housing Authority, working with the HUD Regional Office, the Housing and Urban Development Regional Office, and others who are interested in housing, perhaps not lead poisoning, but just housing in general, will help you develop these plans. Developing a plan is important, but evaluation and continual improvement are also required to determine how the plan is working. A redesign may be needed to achieve primary prevention goals while ensuring adequate secondary interventions. As you provide secondary prevention for a child with a high blood lead level in an apartment building, you can also think about how to achieve primary prevention by providing health education in the other units in the building, or requiring other units to have a test to see whether they also have lead hazards, or making sure that other children in the building are being screened for lead. Then, evaluate primary prevention progress and identify research opportunities. With comprehensive, well-thought-out plans, you'll be able to evaluate progress, make course corrections if necessary, and identify research opportunities to inform decision-making. This slide presents common risk factors for high blood lead levels. There are 3 major categories of risk factors: housing, health conditions, and demographic factors. Risk factors for housing include houses built before 1978. Rental properties are more likely to have lead hazards. Poorly maintained properties and recent renovation of older housing are risk factors. The presence of other safety or code violations or an occupational exposure of a family member are also signs of potential lead risks. The health conditions include a sibling or a housemate identified with a high blood lead level. So if the older brother has a high blood lead level, we need to test all the other children in the family. Iron deficiency causes children to absorb lead more efficiently, and children with developmental challenges tend to do more hand-to-mouth activities than children who are developing normally. So these health conditions mean that the child is at an increased risk in these households. Demographic risk factors include age. Children younger than 6 years old are most at risk. Some low-income poor Black children and recent arrivals, refugees, or children coming in from overseas often have high blood lead levels. Poverty is another risk factor. Poverty is related to the rental property and poorly maintained property. 2 pictures of older houses with visible paint peeling from siding and other indicators of dilapidation. So how would you use local data to target services? This is an example from the Ohio Lead Poisoning Prevention Program. This kind of a map has enormous impact. State and local programs can map blood lead levels data to identify areas or populations with disproportionate risk for lead exposure. If you layer your blood lead data with addresses of subsidized properties, or you identify housing where children have been exposed to lead in the past, this can help you identify places and neighborhoods where a disproportionate share of the lead exposure for children is happening. This is a really good way of demonstrating risks. In this particular map, the darkest red color is the places that have the highest percent of lead, and roughly 15 to 20% of children have high blood lead levels, defined as 5 micrograms per deciliter. So decision makers, elected officials, the school department, families, and other stakeholders will all be very interested in seeing this kind of data displayed in this way. A map of Cleveland, Ohio, showing places with high blood lead level data. What are data sources that can be useful in lead prevention program planning? Let's start with identifying high-risk housing. You can get data on high-risk housing from the U.S. Census. At the Census website, you can obtain data about your community by zip code, census tract, or by city. You may also learn the percent of housing built before 1978, or the percent of housing used as rental property. The American Housing Survey is also available at the Census website. The survey is sponsored by the Department of Housing and Urban Development and conducted by the U.S. Census Bureau. The survey is the most comprehensive national housing survey in the United States. The data provides details about rodents on properties and code violations. Often, code violations indicate potential lead hazards as well. Becoming familiar with your local housing authority and code enforcement agencies is also a good practice. Blood lead surveillance data is also useful to provide a good indication of where there are widespread housing risks for lead exposure. So where do you get data on populations arriving to U.S. shores? Refugees are required to be medically screened overseas to be cleared for admission into the United States. Upon arrival, refugees should also complete a domestic medical screening. All refugee infants and children less than or equal to 16 years of age, refugee adolescents greater than 16 years of age if there's a high index of suspicion or clinical signs and symptoms of lead exposure, and all refugee pregnant and lactating women and girls should be screened for lead exposure. The Electronic Disease Notification System, or EDN, is a centralized electronic surveillance and reporting system that notifies U.S. state and local health departments and screening clinics of the arrival of refugees and immigrants with health conditions requiring medical follow-up. EDN was developed by CDC in 2006 and is used under the authority of the Immigration and Nationality Act. This can be a source for identifying new arrivals requiring medical care. Each state has a refugee health program in charge of administering medical exams to refugees and providing resettlement services and additional assistance. Each state has its own process for reporting refugee lead testing results. For example, in Pennsylvania, the Pennsylvania National Electronic Disease Surveillance System is used to track lead exposure among new arrivals. You may also be able to identify sources of data through refugee community leaders. As you conduct outreach to these communities, religious and other community leaders may be helpful. The U.S. Environmental Protection Agency defines point source pollution as any single identifiable source of pollution from which pollutants are discharged, such as pipe, ditch, ship, or factory smokestack. For lead exposure, point sources refer to specific places in which lead exposure can be traced. Surveillance data can also be used to identify point sources. A number of studies have suggested that small airports in which piston-engine airplanes park, take off, and land are found to have clusters of high lead exposure in and around these localities. Piston-engine airplanes use leaded jet fuel. There are other kinds of point sources. You can find these through the Toxic Substances Control Act inventory, which is on the EPA website. That will inform you of potential lead exposure hazards in your community and identify who's in violation of the Clean Air Act. The State Department of Environmental Quality probably may have granular data on point sources. It's a good way to find out if there are metal recycling or secondary recycling facilities in a community. Sometimes these facilities, which recycle all kinds of metals, including lead, can be near a residential community. The local water authority may also have data regarding the age and status of water pipes in a community. So what are the steps in creating and sustaining these community-based partnerships? The first is to assess your own organizational readiness. So really the worst thing you can do is start this process and then figure out that you don't have the resources or the people or the time to complete it. So you need to assess your organizational readiness. Is your organization sustainable? Are you going to be able to support these activities? Are you willing to make people responsible for maintaining partnerships and understand they need protected time to build and sustain partnerships? If you don't have the building blocks in place, then it's better to work on getting the proper resources in place than to start something and fail. The next step is to initiate a planning process. Initiating the planning process means to assemble appropriate stakeholders together and you start talking to them. Talk to housing agency representatives, medical service providers, environmental scientists, behavioral health specialists, education leaders, and so on. You need to identify the key community organizational partners. Now, if you're a local health department official, there's probably someone in your health department, maybe in the immunization program or in the maternal child health program, who's already undergone this process. And they probably have people that they can recommend who would be good partners for childhood lead poisoning prevention as well. Identify key individuals within the community. Just a note of caution, in some cases, the same people are asked to participate in community health and other partnerships over and over again. They get exhausted with all the requests to serve on these partnerships. So list all your organizational partners. Identify their level of influence and interest. For educational partners, their influence may be with the county school superintendent, parents, teachers, educational organizations, school boards, etc. Educational partners' interests include ensuring that all students in a community graduate from high school and perhaps receive additional post-high school education or job training. Participate in resource identification, identify your priority strategies, and then disseminate a product. So let's see how this works. When you're assessing your organization's readiness, are you willing to commit several months at least to developing a primary prevention strategy and cultivating community partnerships? Is there a clearly defined population that you'd like to help by providing additional or better services? Do effective interventions exist for this population? So are you thinking about primary prevention? Can you get access to data community partners and stakeholders? Can you get access to the data? Can you reach out to people? Do you or your organization have a previous history with some or all of the stakeholders? That could be a positive or a negative. You should understand what these previous interactions have been between your organization and these stakeholders. And do local organizations have the capacity to implement lead prevention interventions? These are questions to ask to assess personal and organizational readiness to build and sustain community partnerships. How do you initiate the planning process? Okay, the first is to form an internal work group. And these are the people that should stay with the partnership engagement throughout the process of developing that engagement, and hopefully will continue the work in the future. The work group and the sponsor, or you, should define the purpose of the community coalition and devise a communication plan to keep everybody informed. Communication is key. Make sure that everyone who has some connection to preventing childhood lead poisoning understands what that work group is doing and why. Develop a timeline and a plan of action. It's really important to develop a timeline that documents early successes. If your plan of action includes ways to improve screening rates among high-risk children, a first step on your timeline might be to meet with the largest pediatric healthcare providers in your community and provide them with the information on how many children in their service areas actually had a blood lead test in the last year. The reality of the statistics may be a wake-up call to some, and it's really easy to get people more engaged when they understand the scope of the problem. So how do you identify community partners and gatekeepers? Community partners are those people who have spent enough time in the community to gain special knowledge. They have what's called local knowledge. They are thoughtful observers and informal historians that can articulate important issues of culture, key groups and relationships, and perceived barriers. Mothers of lead-exposed children are one example of key community partners. They are in the community, they've been through the whole process, and they understand what the barriers are to preventing lead poisoning. Stakeholders are those individuals or groups that are affected by the issue. So a gatekeeper may also be a stakeholder, but is not always a stakeholder. Gatekeepers are individuals who know the community, its issues, and its players. They may be leaders themselves and often influence community issues. They are well-known and respected community members, and you may be able to reach them through existing networks that you or your organization have developed over time. These could be elected officials, they could be religious leaders, they could be a lady in the neighborhood that everybody goes to when they need some help, and you can reach them by actually interacting with people within the community. Here are some questions to ask to refine and understand your growing list of community partners. Which individuals, agencies, or organizations have influence? And what is their sphere of influence, right? So their influence might be they are the property owners association in a community. So they have influence over how property is maintained. And it would be very important to include them in thinking about how you're going to make the housing in the community lead safe. Who has the time, resources, and flexibility to attend partnership meetings and take responsibility for action items? You can't use the same people over and over again because they'll get exhausted, so that's one problem. The second thing is thinking about people that may be excited about the idea, but they just don't have the time to come to meetings, and they don't have the time to execute the action items. So it's important to talk to people very respectfully, but to get an honest assessment of what they feel like they can contribute to the process. Are key individuals community residents, or do they work for a community-based organization? If they work for a community-based organization, you want to know, who does that community-based organization report to? Does it report to a foundation? Is that a local foundation or a national foundation? What's the mission of that foundation? Do they report to the local government? You need to understand what the lines are in terms of their accountability and what the goals are of their organizations. It's very important to list all organizational partners in your primary prevention plan. So think about specific roles. The first role that you might consider is someone to help you educate families on how to protect children from lead exposure. The partners for that role include the pediatric healthcare providers in your community, early childhood educators, the libraries that are often sources of information for people in community, the WIC program, community-based organizations, religious leaders and institutions, and realtors. Those are only some of the partners that will help you educate families. If you're thinking about the people who can help you fund the lead hazard remediation, that would be the local housing authority, the HUD regional office, community banks. They often provide housing loans at no or very low interest for remediation of lead hazards and other housing problems. The rural housing improvement programs are very active partners for rural housing, which can often have a lot of lead paint hazards. The community development corporations at the local level are often called CDCs. So it's a different kind of CDC, but these are one-stop shop organizations. Community development corporations, CDCs, are nonprofit, community-based organizations created to support and offer economic improvements to low-income, underserved neighborhoods that have experienced a significant decline in opportunities. These organizations develop affordable housing and are involved in critical life concerns such as economic development, health and sanitation, neighborhood planning projects, and education and social services to benefit neighborhood residents. This is where you go if you need to get your GED, or you need to learn English as a second language, or you need some other kinds of assistance. And they often have a portfolio of housing that they maintain themselves for low-income folks. LIHEAP, or the Low-Income Housing Energy Assistance Program, does have funding for lead hazard remediations and renovations right at EPA, providing material and information for folks who are going to renovate their own homes to make sure that their renovation does not cause a lot of lead hazards. Habitat for Humanity also has a role in helping to do lead hazard remediation. This is only a partial list, but it's a good place to start. So if you're looking for partners that are going to help you identify the high-risk housing in your community of interest, the partners that can help you the most might be the code enforcement agency, the local code enforcement agency. Local code enforcement agencies know where the most poorly maintained properties in a community are, and they know the specific addresses and property owners of these properties. Community-based organizations can give you a good understanding of the housing needs of the people that they serve in their organization. The community development corporations can also help you identify high-risk housing because they're working in the community and they're trying to meet the housing needs of the community. Identify the influence and interest among stakeholders. If the partner or stakeholder is the general public, some individuals may be interested in wanting to improve the health or safety of their community. Their influence and power are substantial. First, they have purchasing power. They can decide they're not going to buy lead paint. And then they may also serve as advocates for lead-safe communities. People with a condition or disease are interested in making sure that affected populations have access to medical services and to remediating or mitigating services. Healthcare providers are interested in improved care coordination. Their influence is ensuring that high-quality services are available in a community, and they have a very powerful voice. Doctors and nurses are trusted people in a community, trusted leaders, especially in areas that are related to health. Policymakers want to make sure that the interest groups, like the people with the disease or condition, are satisfied with what's going on. And their power is in their ability to set rules for how this stuff is going to be implemented. Regulators are interested in public safety, and they also are accountable to the policymakers and the general public. And they hold accountable the people that they fund. Financiers are interested in low cost and efficiency, and their power is related to funding. Drug manufacturers are interested in profits, sales, and devices or drugs, and their influence and power is related to access to goods. As you think about and consider stakeholders and partnerships, it might help to map out their influence and interest as it's demonstrated here. The seventh step is engaging community partners and gatekeepers. The first thing to do is set up appointments to speak with stakeholders to introduce the issue. During these meetings, introduce the issue, explain your goal, solicit their ideas, and determine their level of interest in participating in the process. So an initial interview is probably going to take about an hour. The first 15 minutes should be you talking, and as much as possible, the 45 minutes after that should allow stakeholders to speak in terms of their ideas and their level of interest. Engaging with gatekeepers or community partners in this way is a good way to learn about the community and brainstorm about other possible partners. So in qualitative research, this is referred to as snowball referrals. One of the good questions to ask a stakeholder or gatekeeper is, who else do you think should be involved? What other organizations can you think of that could help us make sure that no child in this community is affected by lead? And then, your team should discuss plans to implement a primary prevention program in the area with subject matter experts. So you'll want to talk to people who've been doing childhood lead poisoning prevention for a while, perhaps in that community. Certainly your CDC project officer is always a good resource. But talk to experts in the area about your plan, and they may be able to help you ensure that it's successful. Participating in resource identification is a good practice for becoming acquainted with your prevention activity partners. Review information sources in your community, and these can include local newspapers, reports, publications, speeches, political platforms, expenditure data, and opinion polls for your various stakeholders and gatekeepers. This will help understand what their goals are and what they've said in the past on subjects related to child health or healthy housing, what kinds of expenditures they have, and what they've funded in the past. Designate a person or group to take ownership of resource identification so team members know who to talk to for these concerns. You need to have a person on your team who's responsible for thinking about resource identification so that your team members can figure out what resources exist and how to access and implement them. The next step is to identify priority strategies by identifying, classifying, and mapping out the various factions in your community and designing strategies to engage them. Think about the strategies that are important to you. First, consider supporters. That means people that want to be involved. They could be from any level. They want to have more decision-making power. They want to provide guidance from central levels, and they want attention to local priorities. So your supporters are interested in actually making some of the decisions about how primary prevention is going to be implemented in your community. You can increase their leadership by requesting their participation in defining and promoting local-level implementation. And this will drive community action. So if you have people that want to help, and they want to be in the decision-making level, it's very important to use them and to promote local-level interventions that drive community action. Likely, you will have other people in your community who may be neutral to childhood lead poisoning. Maybe they don't have enough time. Maybe they have too many other things going on, or child health is not part of their mandate. But they might be interested enough to participate in the process. You can think about ways of involving them in policy design and implementation, and it's really important to consistently inform them of progress. So maybe you have a quarterly report that goes out, or something you put on your website that tells these neutral folks that yes, we are moving along, things are getting better. Or no, we hit this barrier, and we're looking for partners that will help us get through the barrier. And one of the things that they can do is attend community information meetings. So if you can get them to a meeting, make sure that you give them the information that tells you how your primary prevention strategy is working. In addition, you'll likely encounter opponents. You need to think about them. You need to include them at some level in your partnership outreach strategy. They will provide perspectives that will aid in providing holistic views of barriers to childhood-lead poisoning prevention in your community. They may also provide vital feedback on your strategies. In encounters with opponents, you should exhibit respect for their agenda, and if possible, demonstrate how sound lead prevention policies may benefit them. Develop dissemination products to communicate progress and preliminary results of your partnership building activities to stakeholders, and make decisions regarding dissemination plans if the policymakers and managers plan to use the results obtained through your primary prevention plan and analysis, possibly behind the scenes. Only those persons involved in implementing the follow-up actions should be included in the discussion of the results. But it's more likely that you're going to share the results to build consensus among the partners, and then all partners should be invited to discuss the results. The key areas where partners align or diverge should be presented. So you're not going to get 100% consensus across all these very different organizations or people. And where there are places where people disagree, that should be presented in a respectful and informative way. The interests, concerns, and misunderstandings common to most partners and stakeholders should also be reported. People need to understand where the misunderstandings are, where the concerns are, and where the interests are, so that we can use that to continue to find a plan. Next steps include developing specific ways of addressing the concerns of the individual partners and stakeholders and securing their active support. Here are some examples of targeted population-based interventions. Pamphlets and leaflets. It's important to use those that have already been developed, if at all possible. Most programs have developed pamphlets and leaflets. Before starting from scratch and developing and printing outreach materials, make sure to investigate if existing supplies are available in your program. The CDC website on childhood lead poisoning prevention has multiple resources that can be used or modified for your community. Media campaigns, including paid and non-paid segments, can be used to educate people on the hazards of lead and can be used to recruit volunteers. Other ideas include billboards, radio spots, bus bench advertisements, and social media campaigns. The Advertising Council, commonly known as the Ad Council, is an American nonprofit organization that produces, distributes, and promotes public service announcements on behalf of various sponsors, including nonprofit organizations, non-governmental organizations, and agencies of the United States government. The Ad Council is one place that volunteers develop media campaigns. They've worked on lead issues in the past. Consider working with the community-based organizations who work with the impacted population and are knowledgeable about the lived experiences of families. You may consider making presentations to local organizations to spread the word regarding the importance of lead poisoning prevention. For example, to homeowners associations, the local Rotary Club, houses of worship, and a host of other organizations. Health fairs are fun. They're not the best place to do blood lead screening, though. A health fair is a good place to talk to people about renovating. Health fairs are a good place to talk about getting a medical home for children who don't have a medical home. It's very unlikely that folks at a health fair are going to stop and let you do a blood stick on their 2-year-old. Door-to-door campaigns are effective if you identify a relatively small community that has a disproportionate share of the lead hazards in a community. If the conditions are right, enough staff, safety considerations, etc., you may try door-to-door campaigns to generate interest in this issue. I would like to acknowledge that this presentation was developed in collaboration with the American Academy of Pediatrics and Dr. Mary Jean Brown, who is on the faculty of the Department of Social and Behavioral Sciences at the Harvard Chan School of Public Health, and is an internationally recognized expert and leader in the field of childhood lead poisoning prevention. The contents of this presentation are those of the authors and do not necessarily represent the official views of, nor are they an endorsement by, the Centers for Disease Control and Prevention, the American Academy of Pediatrics, the U.S. Department of Health and Human Services, or the U.S. government. Thank you for viewing Module 2, Segment 4. For questions or comments regarding this segment, please send an email to leadinfo@cdc.gov and indicate Training Question Module 2, Segment 4 in the subject line. Now, we'll make sure that your question, concern, or comment gets to the appropriate people. Thank you very much. It's wonderful that you've joined this important work.